Pituitary cancer, symptoms and complications. A person with pituitary cancer might experience headaches, diabetes insipidus, optic nerve damage, and more. However, those with the disease can be asymptomatic. Most pituitary tumors are non-cancerous and may not cause symptoms. However, they can cause the pituitary gland to over or underproduce some hormones, causing health issues throughout the body. Research indicates that 0.1% of pituitary tumors are cancerous and may spread to other areas. This video looks at the symptoms of pituitary cancer, including its complication, management, and more. Symptoms. Pituitary tumors are mostly benign and are called functioning pituitary adenomas. This means they secrete extra hormones in a person's body, causing symptoms and health issues. The American Cancer Society explains that a pituitary tumor causes symptoms either by affecting hormone production in the pituitary gland or by growing large enough to put pressure on the brain and nearby structures. Rarely, pituitary adenomas can become cancerous and spread into other areas of the brain, spinal cord, or outside the central nervous system. The tumor might also continue to produce mainly adrenocorticotropic hormones and prolactin hormones. The Genetic and Rare Diseases Information Center, or GARD, explains that an individual with pituitary cancer can experience the following symptoms: headache, Cushing's syndrome, increased prolactin levels, malignant neoplasm of the central nervous system, enlarged pituitary gland, hemianopia or partial or complete vision loss, hypopituitarism, when the pituitary gland does not make enough of certain hormones, hyperpituitarism, progressive visual field defects, abnormality of central motor function, ataxia, a lack of muscle coordination, acromegaly, a rare condition that results from excessive growth hormone in the body, growth hormone secreting adenomas, diabetes insipidus, where the body loses too much fluid through urination, pituitary gonadotropic cell adenomas, hyperthyroidism, when the thyroid gland produces too much hormone. Related symptoms. The symptoms above can lead to the following secondary symptoms: weight gain, bruising easily, flushed skin, seizures, issues with muscle and bone strength, irritability, anxiety and depression, nausea and vomiting, dizziness, confusion, lactating when not pregnant, low milk production when breastfeeding, menstrual cycle changes, low libido, high blood pressure, irregular heartbeat, large hands and feet, erectile dysfunction, body hair loss, atypical sexual development and growth in children, vision issues. Possible complications. If a person with pituitary cancer does not receive treatment, it can decrease their quality of life or likelihood of survival. An individual might require surgery to remove the tumor. However, the risk of having surgery include vision problems from nerve damage, heavy bleeding, and further damage to the pituitary gland. Other rare complications such as meningitis and cerebrospinal fluid leaking from the brain out of the nose can also occur. The appropriate treatment can correct these complications. Additionally, pituitary cancer or its treatments do not always cause long-term health issues. Symptoms management. According to a 2020 study, managing pituitary cancer symptoms is challenging due to the aggressive nature of the tumor. Treating pituitary cancer typically involves palliative rather than curative approaches. This means it aims to relieve symptoms and improve the person's quality of life rather than cure the disease. Experts typically recommend a combination of surgery and radiation therapy as treatment methods. A doctor may also recommend chemotherapy, particularly when surgery and radiation are not possible or where previously unsuccessful in a person's treatment. These treatments may alleviate someone's symptoms to some extent. Other medications and lifestyle changes may improve the outlook and quality of an individual's life. A person should discuss ways to manage their symptoms with a medical professional. How is pituitary cancer diagnosed? Generally, MRI or CT scans can detect tumors in the pituitary gland. Blood and urine tests can also determine hormone levels in an individual. However, even when using a microscope to diagnose pituitary cancer, experts may find it hard to distinguish between a cancerous and non-cancerous pituitary tumor. Experts may not recognize a cancerous tumor until it spreads into another parts of person's body. Pituitary cancer spreads equally to areas both inside and outside the brain. The tumor is likely to spread in many distant areas of an individual's body, including other parts of the brain and brain blood vessels, the spinal cord, the eyes, the lymph nodes. Certain organs such as the lungs, heart, liver, pancreas, kidneys and ovaries. Is pituitary cancer curable? When a pituitary tumor is cancerous and spreads to another part of the body from where it started, doctors refer to it as a metastatic cancerous tumor. At this advanced stage, it is harder for medical professionals to cure or control the disease, and an individual's prognosis is generally unfavorable. The National Cancer Institute's surveillance, epidemiology, and end results database indicates that someone with pituitary cancer that has metastasized has a 5-year relative survival rate of 30%. This means that on average, those with a metastatic pituitary gland cancer diagnosis are 30% as likely to live at least 5 years after their diagnosis as people without the disease.